Get down into the lumbar spine, each transverse process is quite distinct from one another. Up in the cervical spine, they're not very distinct from one another. The good news is that the transverse processes pretty much line up with the spinous processes. So if you find a spinous process, you can follow it over and you're on the transverse processes. That's not going to be true in the thoracic spine. Because the spinous process hangs down, we're not going to be able to use the spinous process to find the transverse processes of the same segment. Okay? So in the cervical spine, the transverse processes are going to be rather nondescript, especially when you're palpating through muscles. So how you're going to decide if those are moving, I will show you in just a little bit. But to find out what segment you're at, you're actually going to use the spinous processes. Now, I was talking with some of you. C1 does not have a spinous process. Okay? So when you go from the bottom of the occiput, the first spinous process you feel is going to be C2. Okay? Because of that ligamentum nuchae, it's going to be pretty hard to palpate spinous processes of 3 and 4 and maybe 5. That's just the way it is, okay? Particularly for people who do a lot of forward bending, that ligamentum nuchae is constantly being stressed, and so it's going to be thicker in those people, okay? For C1, we can palpate the transverse process of C1. We're going to be going in the same way that we did for the styloid process. Now what you're going to do is keep the head still, and you're going to do a lateral translation on the transverse processes, and if it moves, you're on the transverse process, and if it doesn't move, you're on the styloid process. Okay? So that's how we're going to do C1, and I'll show you in just a minute. Now, if you are trying to count up, so in this next lab practical, we will ask you to find transverse process of C5, or the spinous process of C2. And so we are expecting you to find a particular level. So one of the ways that you can find the level, if we ask you to do a lower level, is actually in sitting. So what is first rib attached to? What spinous process?
5, 6, 1.
T1. Okay? So our 12 ribs attach to our 12 segments of the thoracic spine. Oh, man, itchy nose, sorry. I'll wash my hands before I touch her neck after I did that. So for the rib cage is going to stabilize the thoracic spine. And so you'll be able to find the spinous process of T1 because if you passively extend the person's neck, T1 won't move. But T6 and T5 will disappear as you extend that person's neck. So in sitting, as long as the person can tolerate some extension, you can find T1 because it won't move, and you'll find C7 because it will move with extension. Okay? And the reason that T1 doesn't move is because the first rib attaches to it. So you're going to want to be able to palpate at a minimum the lower cervical spine with a person in sitting. You want to be able to palpate all of them in supine. And then also try to palpate with the patient in prone, because that's where you're going to be able to visualize in addition to palpate while the muscles are still relaxed. For that, you probably are going to need to pull the toilet seat out. It probably is not going to work as well to have their hand up under because now you've tightened up some of the muscles of the shoulder girdle. Okay, so I'd like to demonstrate those all for you so that you can see what I'm talking about. So James, why don't we have you sit first? And yeah, let's have you sit here facing that way. Yeah, actually, let me take a picture from you. So I'm going to have you slip your feet up onto this chair. There you go, thank you. So I'm looking for C7, T1. So I wouldn't be palpating through a shirt, right? So I have my hands on bare skin. Now, if I just look at James's neck, I've already noticed from before that he has a pretty tight suboccipital region. And if I look at the curves of his neck, he doesn't have much of a convexity here, and he's also very flat here. So it would be really fun to it's going to be hard for me to resist that. So typically T1, C7 are going to also be the most prominent spinous processes, so that's a way to know where to start to put your hand. Then I'm going to use my other hand, and I'm just going to extend him. Now does it look like he's getting any extension where my fingers are? No, he's getting all of his extension in his upper cervical spine. Okay, so I'm going to have you relax and sit up straight all at the same time. You're very like military erect, okay? So kind of loosey-goosey erect. Okay. There you go, okay. So go ahead and relax your head. Let me take it for you. Do you see where he's getting it? So for him, this test is a little bit moot because I can't get him to extend in his lower cervical spine. So I'm not going to be able to use that for him because his T1 is not here. Okay, that's too high. But clearly that's where he likes to extend. But at least you can see that that's how much motion I would do. And I'm feeling for under one finger, that spinal segment will move. And on the other finger, the spinal segment won't move when I extend him. Now I'm going to have you lie on your back for me, and we'll put your head down there since that's kind of the direction we're going. I'm going to slip these under. So for the transverse processes, again, I give you that pillow, making you believe that you may be comfortable for a little while, and then I take it. So for T1, again, I use my middle fingers for this, but again, I'm in that gap, the same gap that we palpated the styloid process. But now what I'm doing is I'm coming in and I'm pressing on one side to see if I feel movement on the other side. Okay? And I'm not. Part of my problem, again, is my nails are too long, and I'm trying to be very careful about not going in this way because of my longer nails. So James, I apologize if I... So he's so tight, I'm having to press pretty hard before I feel any movement of his transverse process. But this is how we're going to get C1. Okay? Now again, if I push and I can feel his head moving in my hands, I'm on a styloid process instead of his transverse process. And it's still pretty deep. I mean, if you look at the skull relative to the lateral aspects of the cervical vertebrae, you're having to go in pretty far to get to those transverse processes. Okay? Now, for the rest of the transverse processes, I'm going to be putting my hands in like this, and I'm going to be using the radial aspect of my index finger to actually laterally translate those segments. And what I'm feeling for is there any place where he doesn't move as much, one segment versus the next segment? So again, I'm not going to be able to find exactly what transverse process that is, but if I find an area of limitation, then I'm going to go under, find that spinous process so that then I know which segment I'm on. But if he doesn't have any restriction, I don't need to know, so I'm not going to do it the opposite way. I'm going to find the restriction first and try to name it, rather than name all the segments and then find if there's a restriction there. Okay? Can I have you slide down towards me? I feel like I've got long arms, but every time I have his head in my hands, I keep trying to straighten him out. It's like... Okay, so I'm going to do this side first. So this side is simply just stabilizing and monitoring. So from this side, I'm coming in and I'm doing a little push translation. Do you feel a difference between this movement and this movement?
Yeah.
And this movement doesn't move.
No.
Okay. Nor does that one. Okay. So now I'm going to test first this side over here, the right side. Oh, way better. Okay, do you feel a difference between that and that? Okay. So he's got two segments on this side that are pretty tight. Given where I'm at, I'm guessing 2, 3. Okay. And so I find here it doesn't move. So now I'm finding spinous processes. I've got my middle finger. I don't know, I just like middle fingers for cervical spine. Then, so I have this finger on the spinous process that corresponds to where I felt that restriction. Now I'm going to use this hand to go up from that spinous process. Yeah, so this is 3. So this hand was on 3. Okay, so that's how I then label that restriction. Okay, I'm going to have you go prone for me.
How would you label it if you, like, when you push on the right versus push on the left? So
you would, I would document that
because that would have been
left lateral flexion at C3 was restricted. Thank you. Oops. So I'm going to put this under your feet, or is that too much? Or you can have him slide down so that his feet are hanging off the edge. I don't care which, but it should be one or the other. So now I'm going to come in, and this is nice because you can both see it and feel it, versus where in supine it's based on your hands. Okay? So now I'm coming in. Now, presumably when he was in sitting and I found C7, I would have put a mark on it so that I would have known that that was C7. It's going to be harder to do that extension test with him in prone. So this is one time that I would write on patients. Anytime you do write on patients with a body marker, you should always get permission first. Okay. Okay, so then you're going to just find the spinous processes, and you're going to come up. Now I'm always keeping one hand on the one I found, and then moving up. His C2 is whacked. So it should normally have a very nice curve to it when you're feeling the spinous processes, but his C2, I'm coming up, and then all of a sudden, boink, there's his C2. So something is causing that to be it's actually in a flex position. That's what's making it more permanent. You don't need to know that. Okay? But what you want to do is be able to find those spinous processes. Now, transverse processes, they're at the same level. So if you put your person in prone, if I came down, okay, and I found a spinous process, if I wanted to palpate the transverse processes at that level, I would just go lateral. Okay? The cervical spine is pretty narrow, so you're really only going to want to go about a ½ inch away from the spinous process on either side to be on the transverse processes of the cervical spine. Okay? The advantage to prone is that the muscles are relaxed, you're able to see it. The disadvantage is in this position you really can't test quality of movement, and clinically that's what matters. So supine, you get quality of movement, but now you lose your visualization. You can also test the transverse processes of C1, again with movement in supine, but not in prone. In sitting, it's a great way to find that transition between cervical and thoracic spine. It's a good time to mark it, but palpating any other cervical structures in sitting does not work very well, because now you're fighting against gravity and all those muscles are going to be so tight, and now you're trying to palpate 2 muscles, so that's never a great idea. Okay? All right. So let's go do that. We're going to spend the rest of our 20 minutes just